Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. In this video, we would like to present about mental health issues during COVID-19 pandemic. This is the result of a study conducted by Anirotul Qoriah from Faculty of Sports Science, Semarang State University, and co-researcher Aftina Nurul Husna from Faculty of Psychology and Humanities, Muhammadiyah University in Indonesia. The paper is submitted to 5th International Summit of Public Health and Education. This presentation consists of first, introduction about the problem addressed in the study, second, research method in the study, and three, some findings of the study. COVID-19 pandemic becomes a formidable non-natural disaster challenging the world today. From Johns Hopkins University data for June 2020, there are more than 450,000 deaths due to COVID-19 and more than 5 million positive cases. This fatality causes grief to many people. To prevent the spread of the disease, people are told to do physical distancing and avoid physical contact, to use facial masks and follow health protocol in public places. Many cities are under lockdown, restricting access to public services like school, market, office, and house of worship. Suspected people are told to do self-isolation. This restriction greatly impact economic activities and consequently many people lose their job, leading to increased unemployment and poverty. Measures to contain the spread of the virus inevitably put so much pressure to individuals. From health problems now, COVID-19 pandemic eventually becomes social, economical, and psychological problems. Mental health problems may become indirect long-term impact of COVID-19. Research in this topic is highly recommended to find knowledge and effective practices to help people live better during pandemic period. This research thus tries to explore the progress of research and thought regarding mental health issues caused by COVID-19 and to map out emerging themes. Hopefully it will bring insight for next studies. To answer this problem, we conducted a literature study which systematically reviewed existing scientific articles published in 2020 following the outbreak. Using Google Scholars, we found 58 articles from various journals of psychiatry, psychology, public health, and medicine. This article consists of original research, observation, literature review, letters to editor, and commentaries. To analyze the data, we used content analysis method. We carefully read the articles and took some notes regarding important facts and ideas. Second, we categorized facts and ideas into themes and clustered them into several main themes. Third, we described the main themes and then summarized the finding. Finding 1. Rationale and methods of research on COVID-19 related mental health issues. Concern about mental health issues during COVID-19 pandemic rise from observation of negative social behaviors. These are first supported in mass media. For example, panic buying, increasing xenophobia, fear of misinformation in social media, people are feeling unsafe and uncertain, more incidents of suicide, self-harm, family violence, stress, anxiety, and depression on high-risk group, and rejection to precautionary measures such as quarantine, strict health protocol, and social distancing. To understand the nature of these mental health issues, our researchers were using literature review to find insight from previous mental health studies related to outbreaks in the past, such as SARS and MERS, survey to monitor psychological needs and trend in mental health status of general population directly or indirectly affected by COVID-19, and qualitative approach to probe individuals' experience living under social restriction. Finding 2. Psychological response to COVID-19 pandemic. Other research were successful to describe how COVID-19 affected people. COVID-19 does not directly cause mental health problems. There are several mechanisms that mediate inadaptive psychological reactions. Those mechanisms are economic effect, social distancing and isolation, family relationship, health-related behavior, disruption of social services, disruption of education and transportation, social disorder, and finally, psychosocial effect. For example, when social restrictive policy is enacted, people's daily life is disturbed. Some people lose their income while others experience increasing demand at home to work as well as take care of children. These contextual factors increase negative emotional reaction, unhealthy behavior, and further non-compliance to health directions. Third, the vulnerable groups. The risks of mental health issues are more prone to be experienced by vulnerable groups. We can classify those groups into two categories. First, group at risk of impact of COVID-19, and two, group at risk of impact of COVID-19 precautionary measures. The first group are people who have direct or indirect contact with the virus, people who have existing condition physically, such as chronic illness, and psychologically, such as mental disorder or psychological problems, health workers, and people who follow bad news in media. The second groups at risk of impact of COVID-19's precautionary measures are older people who live alone, young people who stop schooling or lose job, women in dysfunctional family, people of East Asian ethnicity due to xenophobia, people with mental health problems or use drugs or in recovery or with disability or reduced communication ability, homeless people, people in criminal justice system or social institution, undocumented migrants, and people with low incomes. The last finding is potential of telemental health. Some studies examine strategies to promote mental health during COVID-19. The most notable topic is the consideration of utilized telemental health. The use of digital communication may be an effective method to deliver psychological service when face-to-face interactions are limited. Conclusion. During COVID-19 pandemic, mental health issues is defined as inadaptive psychosocial response ranging from emotional reactions, unhealthy behaviors, and non-compliance to public health instructions. Elevated stress is more likely experienced by people from vulnerable groups. Mental health promotion efforts should be focused more on this group. To understand more about the nature of mental health problems during COVID-19 pandemic, we can conduct research using various methods such as literature study, quantitative survey, and qualitative study. Findings from multidisciplinary research will be crucial information for intervention programs. For further discussion, please contact email Anirotul Qoriah at mail.unnes.ic.id. Thank you for your attention.